Hello, everyone. This is Dr. Ben. It's another episode of the Treble Health Podcast. Today, this is another day where we answer your most commonly asked questions about tinnitus, the ringing in the ears. It's what we focus on at Treble Health. It's what this YouTube channel focuses on. So with that, let's bring in the questions. Number one, what makes my tinnitus worse? Number two, can you be successful with tinnitus? And number three, what is the most effective treatment for tinnitus? I am here with another one of our audiologists at Treble Health. Her name is Dr. Michelle Neidleman Kennedy. Dr. Michelle, let's take it away. I'll ask you first, what makes my tinnitus worse?
There are many different things that can make tinnitus worse, but three of the most common reasons are one, loud noise exposure, stress and anxiety, and lack of sleep. So let me dive into a few of these a little bit more in depth. So when we have loud noise exposure, we can cause temporary threshold shifts in our hearing that then result in increases of tinnitus or sometimes onsets of tinnitus. So you may have already experienced this at some point in your life when you went to a very loud bar or a loud concert and you left and then you noted having some temporary tinnitus. That can be quite common and quite normal. And it is also still a normal thing to happen if you do have more long-standing tinnitus, that sometimes if you do go to a very loud, noisy environment, you may notice a fluctuation to your tinnitus. The second most common reason, stress and anxiety. So we know that stress and anxiety exacerbate tinnitus. Tinnitus is very strongly linked to our limbic system, the emotional centers of our brain. And so the way that we're feeling can trigger onsets or increases to our tinnitus. When we are in more calm states, mentally and physically, oftentimes our tinnitus tends to follow suit. So if you are experiencing greater periods of stress unrelated to tinnitus, you may oftentimes notice an increase of your tinnitus at the same time or shortly following that change in your overall stress level. And then the third most common reason is lack of sleep. Sleep is very important. It's when we mentally and physically reset. We learn the things that we start to embed the things that we've learned throughout the day into our mind. And so if we're not getting sufficient sleep, we're not as able to function emotionally, physically, mentally the following day. And so those are oftentimes the moments where our tinnitus tends to get to kind of take over more, get the best of us. We might be more emotionally reactive to our tinnitus on those days that we're having less sleep.
And I would say one of the pieces here to bring it home is that all of those situations can happen unexpectedly. So no one plans for a tinnitus spike. It's a surprise. It happens by accident. It happens after I forgot to wear earplugs to a loud concert. It happens if I'm in a loud place and I wasn't expecting it to be that loud. And then for a few hours or maybe a day or two, tinnitus can be spiked after that. That can create a lot of negative loops and it can easily bring us to that tinnitus trap of stress, anxiety, tinnitus, all that. And then like you had mentioned, stress or anxiety can spike the tinnitus. That's another very common cause of a tinnitus spike when we're working with patients online in telehealth, one-on-one Zoom consultations on an ongoing basis. The stress or anxiety in something completely unrelated in their life creates a spike in tinnitus. Dr. Michelle, do you find that patients connect the two one-to-one, or sometimes they do, sometimes they don't? Because if tinnitus spikes, and I don't know why, it can be extremely, challenging, stressful, create a lot of fear. Are your patients able to connect stress in other parts of their life with tinnitus spikes?
Absolutely. Most of my patients are able to align periods of high stress and anxiety with some of the most trying times with their tinnitus. But it can often be like the chicken or the egg type of situation where is it that the tinnitus itself is causing stress, or is it that some outside stressor is causing an increase of tinnitus? And I think that really has to do with the fact that when tinnitus started to become problematic for an individual, it has been tied to certain set of emotions, stress, anxiety, worry, anger. And so over time, our brain starts to associate those things with one another. And so we may start to feel stressed or anxious because of an outside factor completely unrelated to tinnitus, but then it starts to include tinnitus. Our mind starts to include tinnitus into the equation, and they kind of work off of one another, where now we were stressed about something like work, and now we're also stressed because our tinnitus seems to be a little bit more pronounced. So it oftentimes is very much interrelated, and sometimes it's hard to know which is truly driving the other.
Yeah. Guys, we got this. We can manage stress. We can manage anxiety, and through that manage tinnitus. Okay. And the question number 2 from the community is, can you be successful with tinnitus? Well, there certainly are tinnitus success stories, and we try our best to have those individuals share on our podcast, come on YouTube channel. There's many more who simply don't want to be visible on YouTube. But overall, Dr. Michelle, what are your thoughts? Can you be successful with tinnitus?
Yes, you can. Tinnitus, while we understand annoying, worrisome, troublesome, stressful, it doesn't have to inhibit you. So you can continue to live your life, do well in work, do well with your family, do well with your friends, continue with your hobbies, despite the presence of tinnitus. Our brain truly does perceive tinnitus much the same way it perceives all other sounds in our environment. And you can probably relate to times of your day or moments of your life where you were able to filter out certain sounds and focus on the thing that you wanted to do. And that is exactly what can also happen with tinnitus, where we can learn how to filter and tune it out so that you're able to fully immerse yourself in the activities that you want to do, whether it be reading, studying, working out, going out to eat. You don't have to feel as though tinnitus is a ball and chain in your life. How often have you wondered, how does someone possibly live by an airport, a highway, or by a busy bar? Because we truly learn to habituate and tune out those sounds because they don't have any kind of emotion tied into them. We know what they are. We're not worried or fearful of them. And so our brain tunes them out and we're able to sleep, eat, read, whatever it is that we want to do, despite the presence of those sounds.
One of my favorite examples for that analogy of how does the brain habituate to sounds and what are the nuances to why that is something that I created and just thought of one day, because one day I was walking in the city and there was I used to live in urban areas, still spend a lot of time in urban areas, lots of electrical lines, right? And maybe you've noticed that sometimes certain electrical lines have that buzzy, high-pitched charge to it. It's going zzz. I can hear it. It's happening. And that's unlike most electrical lines, but sometimes that exists. Imagine that high-pitched, buzzy electrical line, and there's an apartment complex next to it. Well, people who move into that apartment complex, they are exposed to that sound all the time. If they go into that apartment complex and their neighbor tells them, you need to be very careful of that electrical line. The last family that used to live in this apartment got injured because one of the children was playing next to it and they got hurt. It's very dangerous and we don't really know what it's going to do. So be careful. Now imagine that experience versus someone moving into the apartment and they have a more realistic understanding of, oh, it's just an electric line. I know that it could be harmful, but in most cases it's not. And I'm living here. So those two individuals, situation one, situation one, their brain is more likely to focus on the sound because it's a perceived threat or danger. Whereas situation number two, they're more easily able to habituate the sound naturally. So we can see this as parallels to tinnitus, because if there's fear, unknown, a mystery about the condition, that's only going to prime and feed the limbic emotional brain to pay more attention to it, be more focused on it, and have a harder time habituating. So all this to say, let's unpack all of this tinnitus and what it means. And that's one of our main missions here on our YouTube channel. Let's transition, Dr. Michelle, into third question asked by our community. What is the most effective treatment for tinnitus? Excited to hear your answer on this.
Numerous studies have found that combining sound therapy with counseling is much more effective than just using sound therapy or counseling alone. So we always advocate for combination type treatment where we're using both sound therapy as well as counseling. And that counseling is going to include both tinnitus retraining therapy methods as well as cognitive behavioral techniques. And ultimately, both of these types of counseling work together to help change the way that your mind and body are reacting to tinnitus. I'm going to show you a graph, and here we can see that this is tinnitus research. So 118 individuals with tinnitus were studied, and we were looking at whether or not just using sound therapy or masking alone was sufficient to help improve their tinnitus handicap index scores, or if they were doing sound therapy in addition to counseling, how much better was their overall improvement in their THI score. So as you can see here, both groups improved, but over time, those that had both counseling and sound therapy had much greater improvements. So that is why we advocate for always including sound therapy in conjunction with counseling.
And I'll add, well, as that image is on the screen, it's so crucial to notice that the first 3 to 6 months are not drastically different, nor are they drastically improved. So the treatment of tinnitus is a long tail approach. It's a marathon. Prepare for that. Don't give up after 3 months of nothing really changing.
And it's also really important to note that there's so many different types of ways to incorporate sound therapy. So for many, it'll start by using a sound machine, a speaker, their telephone. For others, it may include actually using ear level maskers or their hearing aids to help provide sound therapy for them throughout their day. And we have another graph to kind of showcase how sound therapy really helps to sort of take the edge off of tinnitus. So you can see here in this graph that we have the background noise floor and then our tinnitus. And you can see that there's a big difference between the background level of sound and our tinnitus. When we start to add in sound therapy, enriching the environment with sound, we're adding in a signal. And so now the noise floor or background noise has increased. And so there's a smaller difference between the overall volume of your tinnitus and now the new noise floor, which helps us to better habituate, better filter out, better calm down in response to the sound of tinnitus because it's not as loud as it was when we had a lower noise floor.
For many who research what should they do about tinnitus, and if you listening have been there, it can be overwhelming, number one, because there are these alternative treatments, there are these experimental treatments, there's research going on, and then there's this tried and true method, which at initial glance, one would say sound therapy and counseling. No, there must be something better. Well, there's not. This is good. This is good enough. This is sufficient to get to the result that you want to go to. There is nothing better. If there was, we would be talking about it. So this is the most effective treatment for tinnitus at the time of making this video in May 2022 and beyond. We don't expect this to change in the next upcoming years. So there are considerations like bimodal stimulation. Sure, we would consider that, but that would only be supplementary to this approach of sound therapy and counseling. Don't forget that. And whether you're asking yourself, should I do CBT? Should I do TRT? For those who don't know, CBT is cognitive behavioral therapy. TRT is tinnitus retraining therapy. Essentially, one is in that question, one is asking, should I focus more on the psychology or more on the sound therapy piece of this? The answer is both. It's not A or B, it's A and B. Do both simultaneously, and that's likely to get the result you're looking for. That's what we see all the time. That is what our business at Treble Health is completely based around, because we're taking those best practices and giving them in a convenient telehealth model. We work with hearing aids. Hearing aids absolutely help. When the hearing aid is programmed as the tinnitus masker, it is the gold standard. It is the best sound therapy. There's no denying that. So those absolutely help. Use those. Work with a tinnitus qualified counselor, whether that's an audiologist on our team, a psychologist that knows a good bit about tinnitus. When you do all of those and you're patient, you will habituate. That's what we see. Dr. Michelle, I really appreciate you sharing your knowledge here. Did you have anything else you wanted to add?
So ultimately, we'd like you to know that there are things that can be done to help make you feel successful with tinnitus, help make the tinnitus better, help make it more manageable, and just stick to the tried and true methods, which is what we like to do with our patients. And I'm sure that you're going to find that over time, your tinnitus also improves.
Thank you, everyone. Take care. If you're not already, make sure to subscribe to this YouTube channel. And on the next screen, you will see 2 videos that you can watch next. The next one that I would recommend is called the 6 Best Sound Therapy Treatments, where we go into more details on the different technology and how you can use them. See you there. Take care. Bye.